Hello everyone, good evening. Today, under the oncology nursing, we will be talking about nursing interventions and management for solid tumors. So, under that, now we are going to discuss about tumors of lung, or basically about lung cancer. At the end of this session, you should be able to define what lung cancer is, explain the classification of lung cancer, briefly describe the clinical manifestation of lung cancer, state the risk factors of lung cancer and their contribution, explain how to diagnose lung cancer, and briefly explain the treatments of lung cancer. So, let's go on with the presentation. Lung cancer. Lung cancer usually starts in the lining of the bronchi, but can also begin in other areas of the respiratory system, including the trachea, bronchioles, or alveoli. It is the leading cause of cancer death in both men and women. Lung cancers are believed to develop over a period of many years. So basically, lung cancer doesn't develop within one day. That's not an acute process that develops within a period of many years. That takes some years to develop. And the most common point where lung cancer develops is bronchi, and also it develops in trachea, bronchioles, or alveoli. That means inside lungs also that develops. And lung cancer is the most common leading cause of death in both men and women, the cancer death. Then lung cancer, why most of the time lung cancer at the time of diagnosis it has spread a lot. Why is that? Because lung itself doesn't have any pain receptors, any receptors that detects pain. The lung tissue doesn't have any pain receptors. So most of the time lung cancer is detected in another screening test or when it causes other symptoms. Lung cancers generally divided into two main types. First one is small cell lung cancer or small cell carcinoma, and non-small cell carcinoma. Non-small cell lung cancer is most common than small cell lung cancer. Non-small cell lung cancer, squamous cell carcinoma, adenocarcinoma. In non-small cell lung cancer, there are two main types. One is squamous cell carcinoma and the other is adenocarcinoma. Squamous cell carcinoma is the most common type of lung cancer in men. It often begins in the bronchi, usually does not spread as quickly as other types of lung cancer. Adenocarcinoma usually begins along the outer edges of the lung and under the lining of the bronchi. It is the most common type of lung cancer in women and in people who have never smoked. Most of the time, people who haven't smoked, they also have a risk of developing lung cancer, and that they develop, there's a tendency to develop adenocarcinoma, and adenocarcinoma is common type of lung cancer in women as well. Here you can see how does a squamous cell lung cancer looks like and adenocarcinoma looks like under a microscope. Non-small cell lung cancer, then we have large cell carcinomas. That a group of cancers with large abnormal looking cells. These tumors usually begin along the outer edges of the lung. Then we have adenosquamous carcinomas, which begins in flattened cells when viewed under microscope. These cells also have secretory characteristics. That means they can secrete things. Then we have undifferentiated carcinomas, involves in abnormal looking cancer cells that tend to multiply quickly. That means it divides and it grows very quickly. Again, in this photo, you can see the difference between large cell carcinoma cells and adenosquamous carcinoma cells under a microscope. Then we have the second major type of lung cancer, that is small cell lung cancer, sometimes called oat cell cancer. Here, that is sometimes called oat cell cancer because of the cancer cells may look like oat. I'm sure you know what oatmeal and oats. So cancer cells here refer to this diagram. Here you can see how does cancer cells looks like. They looks like oat seeds. When viewed under microscope, grows rapidly and quickly spreads to other organs. So the small cell lung cancer is a rapid growing lung cancer and it spreads to other organs as well. Clinical manifestations of lung cancer. Symptoms relating to carcinoma of lung depend on the anatomic location of the tumor, extension into surrounding structures, metastatic spread, and the systemic effects of paraneoplastic syndrome. Symptoms in either due to endobronchial growth, extensive growth, or regional spread of primary tumor. Yes, as I mentioned before, here lung cancer symptoms mainly due to endobronchial growth, extrinsic growth, or regional spread of primary tumor. Because why? Inside lung, the lung tissue doesn't have pain receptors. It doesn't cause any symptom. Normally people seek medical attention when they have pain. Yes? Right. Then we have clinical manifestations which depends on the location of the tumor. If the tumor is centrally located, that associated with stridor, wheezing, hemoptysis, the coughing out blood, dyspnea or shortness of breath, and chest pain. The most common symptom is cough due to endobronchial erosion and irritation. If it is situated peripherally, the peripheral tumors are associated with chest pain. Yes, what kind of a pain is that? That's a pleuritic chest pain. You might be wondering, if the lung doesn't have pain receptors, how does chest pain occurs? That's a pleuritic type chest pain when it irritates pleura because tumor is situated peripherally. Then cough and dyspnea owing to pleural and chest wall. The following are the most common symptoms of lung cancer. However, each person may experience symptoms differently. Here we have shown some of the very most common symptoms of lung cancer. Those are constant chest pain, shortness of breath, wheezing, recurrent lung infection such as pneumonia or bronchitis, bloody or rusty colored sputum, that is very common, bloody or rusty colored sputum, and hemoptysis. Then we have porciness, swelling of the neck and face caused by tumor that presses large blood vessels near the lung. When the tumor presses large blood vessels, the draining becomes obstructed and blood pools up back in large blood vessels, maybe in superior vena cava. So swelling of neck and face occurs. Then pain and weakness in the shoulder, arm or hand caused by tumor presses certain nerves near the lung. Then we might have fever of unknown origin. Like all cancers, lung cancers also cause fatigue, loss of appetite, unexplained loss of weight, headache, pain in other parts of the body not affected by the cancer, and bone fractures when that metastasis to bones. Risk factors. Risk factor is something that increases person's chance of getting a disease such as cancer. As we mentioned earlier also, different cancers have different risk factors. Main risk factor for lung cancer is smoking. Smoking is the leading cause of lung cancer. with more than 90% of lung cancers thought to be result of smoking. Those who stop smoking reduce but never eliminate the risk. In one research, they have identified that to get off with the risk or to eliminate the risk of developing lung cancer, for a smoker to eliminate this risk, it takes 20 years after stopping smoking. Then other risk factors are cancer causing agents in the workplace or occupational risk factors, including radioactive substances such as uranium, arsenic, vinyl chloride, nickel chromates, coal products, and chloromethyl ethers. Then other risk factors include family history, vitamin A deficiency. People who do not get enough vitamin A are at increased risk of lung cancer. Taking too much vitamin A may also increase lung cancer risk. And next risk factor is air pollution. Investigations. How to diagnose lung cancer? We have different investigations. In addition to complete medical history, to check risk factors and symptoms, and in addition to the physical examination to provide other information, we also can use chest x-rays, other special x-rays, sputum cytology, needle biopsy, and specially bronchoscopy. Treatment depends on levels and the type of cancer and the location. Specific treatment will be determined based on age, overall health and medical history, extent of the disease, tolerance for specific medications, procedures or therapies, expectations for the course of the disease, patient opinion or preference. Sometimes patient may not prefer a surgery. They prefer a palliative care or they prefer another method. So, on patient's preference, surgery, radiation therapy and chemotherapy may be used in treatment of lung cancer. Surgery, there we have different types of surgery. Under that, three main types of surgery are most often used. First one, segmental or wedge resection to remove a small part of lung. Then we have lobectomy, removal of an entire lobe of the lung. Then we have pneumonectomy, removal of an entire lung, so patient can survive with the other lung. Then we have radiation therapy, use of high energy rays to damage cancer cell and stop them from growing and dividing, and chemotherapy, use of drug to kill cancer cells. And that's it about lung cancers. We hope you understood something from this presentation and this will help you in your academics. We wish to see you very soon at our premises and we will discuss more about lung cancers when we see each other at our premises physically. We wish you all to be safe during this time period and we thank you for your kind cooperation and thank you very much for your time.